Welcome to the Primary Care Pediatric Bootcamp. Parul and I are here today to talk to you guys about why kids are not just little adults and talk about the different challenges and joys that makes taking care of kids so much fun. So Parul, let's start this thing by talking about the biggest differences between kids and adults.
Yes, they are definitely not just little adults. So one of the big things we think about is these are developing bodies, developing minds, developing human beings. And so they have different physiologies. The first thing we think about that you and I both see are vital sign changes.
Right. I think a lot of this can be very alarming to someone who hasn't seen a kid. They're looking at the sheet that the kid that they're waiting for. They see the blood pressure is 80/40 in the infant. They're going, oh my gosh, somebody call a crash cart, but it's really a normal blood pressure for that age.
Yeah, or a heart rate of 140, and it's, in the newborns, that's very normal, but don't get too comfortable with that, because if you see that in a teenager, be alarmed. It is way too fast. So
Exactly.
You have to know your vitals for ages.
Right, and I think just knowing trends is really important. As you start out as a baby, your heart rate starts out high, gradually goes lower. Your blood pressure starts low, gradually gets higher. Your respiratory rate starts high, gradually gets lower.
Absolutely. And then in addition to all these kind of like physiologic changes that are occurring, you also have just, these bodies developed, in utero. You don't necessarily know everything that happens. So if an adult has a urinary tract infection, we treat the urinary tract infection. But in kids, if they have a urinary tract infection, we oftentimes have to just kind of dig deeper and see, is there something anatomic inside that we missed? If, they are presenting with something cardiac, there could be a congenital heart disease. So pediatrics is the time when you discover these things, whether it's at 2 months or 6 years or 15 years, you discover it as you go.
Right, and they don't come labeled, unfortunately.
No, they do not.
So it's up to us to kind of pick up those subtle clues sometimes to figure out that they might have been born with something abnormal.
Yeah, and then you've also got this whole concept of development. So, you have to look at not just the chronological age of the child when you're talking about so many things in pediatrics, but you have to look at the developmental age of the child as well.
Right, knowing those milestones of what's abnormal and what's normal, I think is a really big challenge to know, if you don't have your own kids, and even if you do have your own kids, recognizing that is a skill that takes time.
Yeah, because how you approach sleep in a teenager is going to be different than that of a 2-year-old or a 1-year-old or a newborn. So you got growing minds, you got growing bodies, you got growing human beings, and it all comes together into making it that kids are just not little adults.
Right, and I think parents are the other part of that equation, right? They are going to come to you saying, hey, is my kid developing normal? Is this normal? Is that normal? And it's very challenging. Part of what I think is also really challenging is as the child is growing and developing differently, you have to approach them differently.
Yeah, so it's really kind of a great part of your day when you're working with patients is to have that little icebreaker where you're kind of interacting with the kid and helping engage them in the process. So you have to kind of know their developmental age in order to do that. So building a rapport with children is going to largely depend on, again, their chronological and developmental age and how you build that rapport with their families. Remember, when you take care of yourself, it's one thing. When you're taking care of your child, it's a completely different thing. It is an honor. It is a privilege that we have been invited into the lives of these families, and that you're entrusted to kind of dig deep with this family in raising the most important thing in the world, which is their child. So take the time to build the rapport. It's so important.
Right, and not just with the child, right? Like when they're little, it's fun because they're like puppies who don't know any better. They come to you till they reach about 8-9 months, and then they get stranger anxiety and they hate you until they're probably about 5 years old and they know who you are again. But just I find that challenge of connecting with the kid to be a really another skill that you sort of have to build, just knowing where they're at developmentally to know how to approach them to successfully even examine them.
I feel the best advice I can give is just bring out the kid in you. When you're a pediatrician, the more kid-like you are when you're in that exam room, everyone just kind of just rests a little bit and there's a little bit of peace. So enjoy it. Some parents can be a little bit more stressed if they're coming in for when their child's not developing well or when there's something wrong and it's not going as expected. Sometimes these parents can seem difficult. Because it brings out our kind of insecurities or our uncertainty of how to deal with it. So recognizing that discomfort and just kind of going in and remembering that your partners in the care of this child, that you are together with the parents, you're on the same team, is so important to keep that mind frame, in context.
I agree. And I feel like when I talk to my colleagues who care for adults, their big thing is like, I love kids and I would be glad to take care of kids if it weren't for the parents. But I find that to just be another exciting challenge at times. Sometimes it's hard because we are culturally coming from a totally different place, or their ideas of what they want to do with their child, and ultimately it is their child, is very different from what I want to do medically, and kind of coming to those compromises can be another interesting challenge.
Yeah. So the cultural intersectionality, no one family is a monolith. So it's just because a family is an immigrant, or just because they have a certain traditions, it doesn't mean that family embraces that. So really getting into the unique choices and perspectives of the family as an individual is important. And so embracing that, watching your biases, keeping that in check. Keeping an open mind is important.
Right, but I love that message that you had about really keeping your eyes on the prize, which is the care for that child to make them thrive, regardless of what else is going on in the family.
Absolutely. And that comes into, shared decision making. So this is where it's not just you in this diagram. You've got, the family, you got the patient, you've got the healthcare system, you got maybe others in the community, really, and sometimes it's grandparents, sometimes it's, whoever's important to the life of the child. Engaging that child's community is what's going to help them thrive.
Right. And I think it is so different in pediatrics that a lot of the times when they're really little, you're caring for the child, but a lot of times you're caring for the parent to help them actually care for the child. And they don't always, and there's not always clear-cut recommendations on stuff. So you got to figure out with them what's going to be best for their individual case. And that is a shared decision.
Yeah, and I think that's another thing that's different than adults, is because an adult is responsible for their life and you can talk to only them. Here you got these people who are proxies for this kid. The parents, the guardians. And so you guys together have to kind of decide what's best for the child. The child doesn't really have their own voice at a younger age.
Right. Okay. The other interesting thing is things change over time. Initially, they're babies and they have no autonomy, and the parent knows absolutely everything about that. It's sometimes a very big challenge as they transition to those older years to get the parent to let go a little bit, to let the child spread their wings, and especially when it comes to things like confidentiality of maybe there's things that the parent is not privy to know about.
Yeah, so that's where you're getting into the age of the heads exam. And that's a very unique time where you're talking about sex, drugs, rock and roll, and all those things that are very important to an adolescent. And it's very difficult for them to openly discuss this with some parents, sometimes not. We always hope it's not. But they need an adult who they can trust. And that's where we come in. And many laws in different states support that confidentiality unless they're not going to hurt themselves. So this is a transition, right? This is the child who's blossoming into a young adult, and helping them understand their bodies, understand their health, is a very unique time in the trajectory of a life where that's where they are learning how to make their own decisions. And we are there to support that.
Right. And I feel like we're in a uniquely special place that we can actually affect the arc of that kid's life. If we catch them at the right time, we could maybe prevent a bad habit from happening, or, fix their, obesity so they don't go on as an adult to develop bad habits and heart disease and all those things within there.
Yeah, absolutely.
All right. The other thing that is super unique to pediatrics is we get to advocate for these kids who are unable to advocate for themselves.
Yeah, so advocacy takes place in all different levels. It's you can advocate for them on just that individual level, going to that IEP or individualized education plan for that patient to make sure that they get the educational needs met. It could be something more in the community level, at the school levels, or at the whatever the local community is, and then of course it can happen at the state level or federal level in legislation and the Academy of Pediatrics and different advocacy groups. A lot of changes for the better for our children occur because physicians and healthcare providers in general have a voice that is heard. We're respected as experts on children's health. And so if you are inclined to do so and you have that voice, just know that there's all different ways you can advocate for children.
Very good. All right, Parul, let's talk about the actual course that everyone has signed up for here. It's divided into 3 sections. The first part is all about?
So the first one's about the practice of pediatrics. So this one we're talking about having a practice, maybe some background on billing, some of the administrative things that go on, and just kind of building your setup of how you're going to approach your patients.
And the second part is really a clinical approach. We talk about the most common chief complaints that are out there, the common conditions you're going to run into, how to treat them and manage them, as well as some very practical pharmacology that you can literally use on day one of your practice.
And then finally, you're talking about the procedural fundamentals. These are things that we are a little bit more hands-on, maybe catheterizations. So things that we have to learn to be skilled at as pediatricians just to streamline the care of our patients.
All right, so we hope you guys enjoy this course. We hope you can use it on day one and that it improves your efficiency, your knowledge, and your overall enjoyment of taking care of kids.
Good luck.